Chris Oman, who's going to be teaching the business and policy of healthcare. And Chris, welcome. This is your first OLLI course. We're really delighted to have you.
Well, thank you very much, Susan. And I appreciate the opportunity to talk about and have a course on the business and policy of healthcare. And let me take a moment now to give a little bit of framing that will then ease into the flow of the course. Many know this, but we're getting a pretty bad deal when it comes to healthcare in this country. We pay twice what other industrialized countries pay for healthcare. We live shorter lives, and the lives we lead are led with more disease and more disability. It's a bad deal, and it's a bad deal on a pretty breathtaking level. In one sense, economic, where, when we say we're paying double, well, this is nearly 20% of the US economy, trillions of dollars. And if we're paying double, that means we have waste at a magnitude of trillions of dollars. Then, of course, in healthcare is perhaps the most personal, the most intimate of industries that we have. So we're getting here in what is so personal and so intimate, we're wasting so much. The reasons for this, of course, are many. They fall into a number of buckets: social determinants, access to care, environmental, financing. And financing is what gets an awful lot of the public policy debate about who pays and how much they pay. But running through all of this is cost. What we know is that the cost of services, of products, drugs in the US is approximately twice what it is for that same product, service, drug as it is in other industrialized countries. And that's where this course will focus, is on cost. And the flow of the course will be what's driving the high cost of healthcare. And we'll touch ever so briefly, but nonetheless, on why it is in healthcare traditional economic theory breaks down. We'll talk about, so where does all the money go? And I can give you a hint. It kind of goes to everyone who participates, particularly everyone with power. Then we'll talk and look at insights from other countries. Caution here is there's no silver bullet. There's no magic wand that some other country has, but there are useful insights, and we'll look at those. And we'll spend time on the economic political dynamic of healthcare in the US, the essential protecting and the advancing of special interests, protecting turf, and how that plays out at all levels of government and impacts fundamentally cost. And finally, we'll take a couple of our sessions and we'll look at a variety of different policy options. And then if we have time, I'm hoping what we'll get a chance to do is look at a couple of special circumstances, one of which is being able to service the needs of low-income communities, and secondly, servicing the needs of rural communities. So with that, I sure hope that you'll join me this fall for what I expect will be a terrific and engaging course.
Chris, thank you very much.